Welcome to Eye on You. I'm your host, Tina Hunt, and hosting with me today is host Jeffrey Bennett. He's a former mayor of Corona, California. Jeff, I told you we were coming back. We're bringing back the same guests because in our last discussion, they didn't get through half the materials on healthcare. So we brought them back today, right?
Well, how many hours do we have?
I know. They're
I'll tell you,
prepared.
it was a great debate. I think I learned a lot from both sides. What I liked was, and I wish the people in the Hill would get the commentary down, is we can sit here and agree to disagree, negotiate, but let's come to some semblance of getting something done.
Exactly.
With that, I just can't wait to turn them back on.
Right. Let me ask you this. Did you know that each major political party in the United States, including the Republicans, Democrats, and the Libertarians, have statements supporting youth involvement?
Oh, absolutely. I mean, youth is our future.
Right.
Who's going to be taking care of us when we're older?
We're doing it here, guys. We are doing
That's
it
it.
here. We are bringing them in, and we're allowing them to debate the same issues as the older people.
Oh,
all right?
And one quick thing is, you got a couple questions from some kids that were interviewed
I
that didn't
do.
get to make it, and I
Exactly.
think that'll add just a lot of fuel to this debate. So I
Okay,
can't wait
right.
to hear you present those questions.
All right, awesome. I'll do that toward the end, okay? But right now,
Got
let's
it.
go ahead and
Let's
meet our
rock.
panel right now, okay? On the right, we have Mark Baffiades, and Mark is the chairman of the Republican Party of Los Angeles County. He has also served as the president of the California Congress of Republicans and the Hollywood Congress of Republicans. Welcome, Mark.
Thank you, Tina.
All right, Mark, who do you have debating on the right today?
Well, today we have Howard Hyde. He's the president of the Southern California Republican Women and Men's Club, which has been around since 1935, actually. He's also a columnist with the AmericanThinker.com, FrontPageMag.com, WesternJournalism.com, and his own blog, HHCapitalism.com. Howard is the author of the book, Pull the Plug on Obamacare, which is available on Amazon.com.
Okay. All right, another plug there. All right. On the left, we have Hector Serrano, and Hector is the Los Angeles Harbor Planning Commissioner appointed by Los Angeles Mayor Eric Garcetti. Welcome, Hector.
Thank you, Tina.
All right, Hector, who do you have on the left today debating?
Tina, today I have on the left debating Andrew Bernard. Andrew Bernard was a 2012 Democratic candidate for the Illinois House of Representatives for the 50th District. He served as the Democratic chairman of the Geneva Township. And most recently, Andrew also was a consultant for the integrated eligibility systems as part of the rollout of the Affordable Care Act of Obamacare.
Great. Well, welcome, Andrew. All right, let's get started. To give them more time, Jeff, what is our debate question for today?
Make it short and simple. Is the Affordable Care Act, or better known as Obamacare, is it not one of the most controversial laws in recent memory? And I would just like to let it go and pick it up where we left off.
Okay. So we're starting
So
with
let's start with the left.
All right. First of all, what is the Patient Protection and Affordable Care Act? In simplistic terms, this law expands eligibility for Medicaid and creates a government-subsidized insurance exchange, along with provisions to protect the American people. Are most Americans for the Affordable Care Act? The answer is yes. Conservative politicians and political action committees have done a great job in smearing Obamacare, as they call it, and spreading false information. Some of this false information includes calling the law a government takeover, which it is not, or that so-called death panels will be implemented. None of this is true. The far majority of Americans are in favor of this law when asked about the provisions themselves. When we look at the Affordable Care Act, one can clearly see that we're taking steps in the right direction. Recent polls have shown that the majority of Americans like this law when asked about it. 71% of adults believe Medicaid should be expanded. 80% are for increasing coverage for dependents. 77% are for eliminating out-of-pocket costs for preventative care. 70% are for guaranteed coverage regardless of pre-existing conditions. Since the Affordable Care Act passed, we have seen the slowest increase in premium costs and spending in years. As time continues, we will continue to see healthcare costs lower as a result of this law. It is worth noting that 60% of all personal bankruptcies are medical related, and 75% of people who file for those bankruptcies have insurance, but are underinsured. This law helps to ensure insurance companies sell consumers fair healthcare coverage that avoid ruining them financially. As you can see, this law protects Americans financially and medically, and the far majority of the American people are for it. Why repeal a law that the majority of people like and is controlling healthcare costs? It does not make any sense.
Howard,
Thank
your
you.
response?
The Affordable Care Act is a failure, a disaster, and a train wreck. It is making health care less affordable and less accessible to more people than it is helping. And it is aggravating the worst employment environment that we've had in 35 years, the most anemic recovery from recession that we've had in 50 years, and it's compromising patient privacy and opening a big security hole to identity theft. The administration's own actions testify to the failure, because if Obamacare were such a great success, Obama himself would not be so eager to use his phone and his pen to carve out special exemptions and favors and to delay the full implementation until after the next and after the next and after the next election cycle to provide political cover to vulnerable Democrat senators running for re-election. It is a failure because it was built upon a foundation of failure. There is no track record of success of the federal government taking over health care for anyone and doing a better job than voluntary exchange, free markets, and charity and mutual aid societies could do. Medicare has cost many, many times more than the sticker price that was advertised to the voters when it was being sold. Medicaid, on which we spend hundreds of billions of dollars each year to cover 50, 60 million people, has been shown to be statistically no better in terms of actual health outcomes than no insurance at all. So what are we getting for our hundreds of billions? The Veterans Administration, which is a single-payer stockade for the ones who have put their lives and limbs on the line for you and for me, is a corrupt, self-serving failure. We need now to pass common sense, step-by-step reforms which empower patients and families and physicians and communities, not the federal government, not the bureaucracy, not the Department of Health and Human Services, not the VA, and for Pete's sake, not the IRS. We can do this. We must do this. Thank you.
Back at you, sir.
Sure, I'd just like to make a couple of points. I wouldn't call this a failure. We have 8 million people with new health insurance who signed up, and we have more 15.9 million people who are on Medicaid now who never had health insurance. The bad business climate, I really don't understand. Corporations are still making record profits last time I checked, so everybody seems to be doing just fine. More of a scare tactic, if you ask me. Why do we pay more for healthcare than other countries in Europe? We pay more, but yet they say that we're going to pay more. Self-serving, that's an insurance company. They make money by declining you.
I've just got to correct something that Andrew said. Andy, I'm sorry.
No, go ahead.
I forgot, this isn't the roundtable session. I think you have a response first. I'm so eager to get at him.
8 million people signed up because at least 6 million of those, you took away their options for the plan that they already had. So you're declaring victory for forcing people into the system that they didn't want to go into. Now, I'm not a cheerleader for corporate profits, über alles. Okay, I'm looking at the job market. We have only 63% of adult Americans actually working today. That's worse than it's been since 1978. And I was alive then, believe it or not. So I remember that.
Now you can go.
Okay.
We'll let you jump in there, buddy.
I wanted to just correct
It's only 30
something.
seconds.
I wanted to correct something Andrew said and ask him where he got his statistics. The latest CBS News poll shows that Americans are against Obamacare by a 54 to 41 margin. 54% against, 41 for, and it has been Americans have been consistently against Obamacare since its passage.
I would be happy to correct that. You are right. When you ask Americans, are you for Obamacare? When you give it a nickname, Obamacare, people don't like it. But when you ask them people don't know what it is. When you ask them what it is, they like the provisions. These numbers that I read don't lie. People like the Medicaid expansion. People like people staying on the parents' health insurance.
That's
People
not the
like-
same thing as liking the law.
People like Santa Claus. Santa Claus brings gifts.
But
He
we're
gives
losing
lots
topic
of
here.
goodies.
People like what
You've
it
talked
is.
about all these wonderful things. Children can be children until they're 26, and more people can sign up for this and get subsidies and so forth. The adults in the room have to deal with the cost.
Adults like
I
it.
think
Adults,
what we
do
need to
people
look
like
at
it or not?
about the
They do not like
Obamacare
it.
is that
They
it
do
created
not like
more
it. If you call it
jobs in
that,
the
they
medical industry. I mean, I work in the hospital, and I've seen more job creations in the medical industry. So I think it has benefited many Americans to
At
actually
what cost?
accept.
People have to buy
that's what's
insurance.
seen. What's the other side where jobs are being lost from some other sector of the economy because we're artificially pumping money into.
There have actually been layoffs in the healthcare industry. I've been in the healthcare industry for 10 years, and when Obamacare was instituted, there were layoffs in Southern California because of that.
Let's just all agree that we all hate the insurance companies. I think we kind of agree on that. The thing is, the insurance companies, as we know them today, are not insurance companies. If you buy fire insurance for your house, that means you're betting that in case of some horrible but unlikely event, you'll be covered, okay? What we're talking about health insurance, it doesn't resemble that. And it's been taken over by even prior rounds of regulation. And now Obamacare comes along and dictates the terms of every single policy. So that's not a free market. And I'm not singing the praises of
Well,
insurance.
I
free
do
market has been
believe that
failing
the
us.
Obamacare is a
But
great
you've
policy.
you have created the conditions under which only the biggest and the baddest and the ones we hate can survive. And if we hate these, wait till we have only one left, and it's the federal
Whoa.
government.
We
Try
still have
challenging
insurance
their
companies.
price.
Where have the insurance companies gone? They're still making money. Senators have said
The ones that have survived are making
Oh,
money.
survived.
The-
Where's Aetna? Oh, they're still here. Aetna's still here.
Okay, where is Minnesota one? Okay,
I have
they
no
just
idea.
pulled
No,
out of
Minnesota won.
Minnesota. Okay, the biggest and cheapest insurer just pulled out of Minnesota because under the terms dictated by the government, they cannot turn a profit.
Vermont, for example, only has 2 insurers left in the state, MVP Health and Blue Cross Blue Shield. All the others have been driven out
What
because
are the
of
quality
this.
of the plans that they are giving these people? That's what I have to question. Because one thing
That's-
that,
you know,
Whoa,
that
hold
is
on, one thing
very-
the
that
president-
is very
one
true
thing-
what Obama
Actually,
said.
hold on a minute. It is my business.
patient
Here,
and the
this is why it is my
insurance
business because they cost us money. If you don't have good insurance, you don't go to the hospital, you don't pay, you raise the cost for the rest of us. That's how
I
it
think
works.
we need to look at the quality of the care that these insurances are given to the people. Because a lot of these insurances are all about making money, and then every
government's not going to make a better decision than you and I negotiating with,
The
with
insurance-
20 potential providers.
The insurance companies make the decision whether or not you get treatment. You call the insurance company.
Under the conditions of restricted competition, you're right. They call the shots because they're protected.
They call the shots anyways. Give them a free market.
ones
Give them
that survive
free
do, the
range.
big
Give them
bad
free
ones
range.
that
They'll do
survive
whatever they
under
want.
these
They
conditions
make
do.
money by saying no. That's how they make money. Why would you want to put that on people's lives?
And-
This is not an iPhone again. These are people.
That's not true.
Children.
That's
I mean,
not
would you deny children health insurance?
Would you deny veterans health care?
Absolutely not.
Well, that's what's happening under your single-payer VA program.
This problem has been going on for a while.
Yes, it has.
You can't blame that solely on Obamacare.
It's been aggravated by Obamacare. You're just taking what's been bad and making it even worse.
More people are signing up and getting
Why don't
quality
we go
care.
back and give those veterans a voucher? We're spending X billions of dollars on health care for veterans. Let's give each veteran his share in his own hand and let him go out and shop on a truly free market.
The VA
for
is the
his-
perfect example of what happens when government gets involved in healthcare. Healthcare
payer.
decisions should be between the doctor and the patient.
And their insurance
And in
company.
Obamacare,
The insurance
it is
company
less
has a
that
big
way.
deal with
Less
it.
that way.
Insurance companies are the middleman. They make all the decisions. There is no
You
such
made the
thing.
insurance
No, they
companies
do not.
the privileged class. You're the ones who did that.
How?
By dictating all the terms, by restricting competition, by saying that you're not allowed to play in this sandbox.
Every
unless you-
insurance,
you,
every state has
comply.
an insurance commission which dictates the terms of all insurance policies in that state.
I understand that, but
It
you're
is
talking
not up to
usually
the
negative
I
insurance
to
understand.
the
You're telling me
people.
they,
There should be more competition and more free market.
so more freedom for
forces
the
here.
insurance companies.
No,
More
free.
freedom for all of us.
Oh, because that's the
competition.
argument of
That's not
libertarianism.
true.
We're free if there's no restrictions, but yet we're not because we don't have good choices. That's the problem. We don't have.
You would get more choices if
If we
had a
gave the
free
insurance
market.
companies a little more leeway.
All right, guys. All right, we need to go to break. When we come back, we're going to meet the youth. And you know what? We're going to see what they have to say about this healthcare game. Back in a moment.
Explore new worlds. Read. Visit literacy.gov.
Welcome back. We have our youth in the room, and they're raring to go. On our right, we have Giuseppe Robalino. Giuseppe is a college student at USC. He serves on the USC College Republicans and the Harvard SSP program. He is also the director of communications for the Orange County Republican Party Youth Association in Irvine, California. On our left, we have Austin Richards. Austin aspires to one day be a medical doctor. He has always loved politics, and he has a great love for this country. In January, he will be leaving to serve in the United States Army. Welcome, Austin. Welcome, guys. All right, here's your question for today.
Back to it, guys. Second phase, great time the first one. Let's do it again. Is the Patient Protection and Affordable Care Act, Obamacare, good for America? And let's see, this time we'll start with the right.
Thank you. Americans deserve access to health care. We deserve competitive health policies at reasonable prices. The left has unfortunately convinced itself that our system failed because we were already previously in the free market. The truth is we've never actually been. There are real solutions that we can implement involving health savings accounts, improving the risk management techniques of insurance companies, allowing policies to be sold overseas and across state lines. Are we helping the poor? Are we helping the poor move out of poverty and have better access to health care? Under Obamacare, we're not, and we need to remember those Americans that are actually going to be hurt more than they're going to be helped. This law is well-intentioned, but really, at the end of the day, the choices of the free market and being able to implement a system closer to that, with government working together with insurance companies, not against them, is actually going to help America be a more prosperous and healthier country and economy.
Austin, back to you, sir.
Looking across the aisle, it's really difficult to listen to the attacks on Obamacare when you understand that everyone in this room, regardless of your party, will someday have a reason to need medical treatment. And every single person will have to pay for that eventually. Obamacare paves the way that we can help others who do not maybe have the means to do so, and where everyone wins out and everyone can make it home safe at the end of the day. And that doesn't discriminate. Obamacare's act has already been passed, and it's already here to stay. And fighting against it is important. All voices need to be heard, but it's time to trust in our president and his vision and follow him. President Reagan said that there are events happening in time and space and beyond time and space that, whether we like it or not, spells duty. And we need to follow that duty and support Obamacare.
Seppi, you got a 30-second response.
Thank you. The duty to the American people is served by the American people, not by the government dictating exactly what it is, how their plans are going to be laid out, how their prices are going to be fixated, and exactly how people are going to have to come about them. The ability to create choice is there. The ability to partner is there. We want people to have better opportunities and better access to healthcare. Just under the current system, it's far too oppressive, and just the choices are not there. And we hope to be able to explore.
Austin, before we go to rapid fire, you get the last shot. 30 seconds.
I think that when we talk about freedom, we want to talk about true freedom, not the freedom of a board of directors to decide things, and not the freedom of an insurance company to make a larger profit. We want freedom for Americans, from an insurance company, and ultimately from our mortal conditions that will turn us to them. And if we can escape these issues through Obamacare, then we will know true freedom.
Andrew, you started with a very good point in the prior show. You talked about your home community where people came together to help out a family that had a health situation, and everybody pulled together. And that's an important point. You're from Illinois, okay? My grandfather raised corn and soybeans, and my father grew up in Joliet. We have some connection. You know, charity and mutual aid societies and communities coming together, that's not something that's not a failure. That's not something that we apologize for. No country in the world has the stronger charitable institutions and organizations than we have in the United States. That's always going to be part of the solution. And what top-down government micromanagement does is it crowds out that kind of thing. It says, oh no, you don't have to do that. You're not allowed to do that. You're not allowed to provide charity care. We need to be encouraging that kind of thing rather than
I think what we need to look at is that the Obamacare has improved the senior citizens by keeping the rates down, and it also expanded free preventive services for many Americans.
Again, you're talking about goodies, and you're not talking about how to pay for them. Who pays the cost?
I'd like to get back to what you said, actually, is that there's nothing in Obamacare that says you can't do charity anymore. That's not true. But hold on. The thing is,
Yeah,
though,
there is.
Hold on. We'll get to that. Well, okay. But the thing is that it's not a failure by the people. You're right. Charitable actions are great. But why should a family have to beg and worry about, oh, will the community come around me? Will we have enough? I mean, a spaghetti dinner is not going to raise hundreds and thousands of dollars in cancer treatment. That's ridiculous.
There have been
the
many-
community did what they could to help, but people shouldn't have to beg to get help.
There are many free clinics in many in communities all over the place that were providing great services for folks. And because of Obamacare, there are regulations that have been put in place that have made them shut down, that they can no longer offer those services to people.
So free cancer treatment? No, not a dime?
Look, there are
We're not
plenty.
talking about free
there are
cancer
plenty of. There are thousands of doctors right now who would be willing to devote a certain percentage of their practice to charity care, pro bono work. If only we would get out of their way, reduce the paperwork, the compliance costs, the liability, and give them a tax deduction for their pro bono work. Why don't we do that, and then more people who need it would get care?
I'm not opposed to that either.
Okay, we agree on something.
Austin,
One other thing, we talk about competition. Laser eye surgery isn't something that's covered under medical care. So you have laser eye clinics popping up everywhere. And there's competition. The price of laser eye surgery is very inexpensive, and it's because the government isn't involved with regulating that as much as it is the rest of the healthcare
Isn't that a problem to begin with, though? If something that's not cosmetic is considered cosmetic. Again, insurance companies decide what they want to do. Something that has to do with vision. Not like I want to change the color of my eye, but I just like to see how everybody else does. Oh, it's going to cost you $2,000. Or maybe the market might bring it down. And maybe
It's
in
been
your case
brought
it
down
did.
tremendously because it's not regulated as much as the rest
Well,
of the
I can't say
healthcare
that's the
industry.
reason,
There has
but-
been many people who have been complaining about the insurance companies. All what they want to do is just make money, and they take advantage of many people. I mean, that's many
Hey, do you
complaints
wanna
that
This
we
is not
receive.
true. The insurance companies can be fought. It's very easy for the left or anyone to really vilify the market and also vilify private enterprise. The thing is that private enterprise has been held down before. It's being held down even more now. If you were to set up a system where government works cooperatively with companies, helps them plan out risk management models, better risk pools, incentivizes them to be able to appropriately hedge riskier clients, riskier patients, people who have pre-existing conditions, and then allows that to be traded overseas with other companies, we can effectively eliminate this risk, mathematically speaking, such that we can pool more people together and give them greater access to healthcare. That has never before been done, but we can do that.
Well, you said better access to healthcare. I feel Obama provides that. I mean, obviously, we have more than millions of people getting some type of healthcare through Obama. I mean, you have senior citizens, working class families, and middle class families. So I really don't see what's
You know,
problem
let's
with
take a
Obamacare.
moment to talk about the poor, the people who are most vulnerable in our society. And as a matter of fact, Austin, you spoke about the freedom of shouldn't be about the freedom of the board of directors making decisions. Well, what about establishing a marketplace where it's about the freedom for people in poverty to be able to leave that cycle of poverty? When we look at the formulas that Obamacare is built under, it's using the same federal poverty level formulas to tranche out these subsidies
It increased the federal
that
poverty level.
Yeah,
that
that's
But you know, let-
that failed welfare
don't wanna be
program.
Let Austin
Make a
respond.
thing- make a thing
Let's
public.
let Austin respond to that. Okay.
You talked about closing the poverty gap. You can't ever assume that there will be a world without poverty. Obamacare doesn't assume that. We can't assume that. There will always be poverty.
Obamacare is part of a series of band-aid fixes by multiple governments across
as
American
opposed to the
history.
Republican solution of don't be poor. I mean,
You know,
Republicans don't want people to be poor. That's exactly
Nobody
right. They
does.
want people to be lifted out of poverty and to have a job and to
But by the way,
educate their kids.
one of the important points we need to get across to the youth in the room is that we're not having this discussion for the first time, okay? There's nothing new under the sun. 50 years ago, we were debating Medicare and Medicaid and whether it was a good idea to spend billions on that. I mean, one might ask, for all of our hundreds of billions, trillions of dollars that we put into Medicaid, what do we have to show for it? Where's the track record of success? I mean, 50 years ago, I agreed with you. Yeah, we should have a program that helps the poor. Well, but
Are you opposed to
whatever
those
whatever program we put in place has to still pass or fail, to see if we want to continue it, if we want to continue the way that we've been doing it.
how would you quantify those results, by the way? You can't get a profit off the poor. There's not any board of directors that you can report that to.
Sure you can. Ever heard of Walmart?
Okay.
Sorry, they provide
guys.
low cost
Listen up, guys.
products.
I need to go to break, and when we come back, we'll take it up right there. Don't go away. We'll be right back.
Cause nothing ever gonna make this world better if we don't start believing that love really, really, really is the answer. Everybody join hands, cause it's time now. Spread the love all over the world. Spread it all over the world.
Welcome back to Eye on You. I have standing with me Makaija Kisi. And Makaija's from our audience, and she's a college student, and she has a question for the panel. Her question is, what happens if the Affordable Care Act, Obamacare, succeeds in some states but fails in others? Okay, panel, let's have that. Thank you, Makaija.
Thank you. Makaija, first of all, thank you for your question. If Obamacare manages to work in some states, and it very might well, we have to realize that central planning can work in the short run. If Obamacare were to succeed in some states, it will be because, just like we did with Clinton and Newt Gingrich, by improving our welfare, by having reform on welfare, it will be because Obamacare will have been reformed. We will have found a way to liberalize the system and be able to actually incentivize more companies to come into the exchanges.
Howard. States which have had the most mandates have also had the highest premiums. The states which have expanded Medicaid under Obamacare have seen an increase in hospital ER visits because the patients covered by Medicaid can't find a doctor willing to serve them under those terms. Any system is subject to the laws of failure and success. And what we need to do is expand the freedom of choice for all Americans so that nobody gets stuck in a failed system the way our veterans are.
Thank you. Andrew.
Well, the question is a really good one, but there's really one reason why it's not going to work. If the leaders and the governor of that state have a temper tantrum about it, like we've seen in Texas. I personally worked on the state level IES in Illinois, and the rollout went great. People are signing up because we have a governor who actually listens to the mandate. The federal government is providing 90% of the funding, and the governor is taking it and is following national orders. Some governors are choosing not to do that, and that's why it's not going to work.
Austin, you have the last word.
There's always the possibility that it will fail in all the states and it will just be repealed. There's the possibility of an incomplete failure and a possible dissolution of the union, which we've never wanted to talk about. But that is the most extreme. If and when Obamacare succeeds, we will proceed as Americans have always done. We will continue, patch up our wounds, and try and do what is right for the future, for tomorrow and for our children.
Thank you. I got to say, as I close this off with my commentary, both of first debate and second debate were absolutely stellar. But I'll throw this question out to you. And I thought about this when I was in high school just now and in college. When I had to get auto insurance as a 16-year-old driver back in 1972, okay, it's going back. It was like $1,800 a year. It was huge money. Now, 15 minutes can save you. I mean, you look at all, that's not a plug for them either, but if auto insurance and homeowners insurance collectively drop so dramatically over the years to where it is like, it's cheaper. If you looked at inflation, it's so much cheaper today. Why ultimately, and granted, I don't believe Obamacare, the Affordable Care Act, is a perfect solution by any stretch of anybody's imagination here. And there's going to be so many reforms. Look, when we came out with Social Security, how did that work for a while, okay? When the Civil Rights Movement was signed by Johnson, how did that work out for a while? The changes and changes. Definitely, it's not a perfect system, but you know, in the last 100 years, we have to start somewhere. But gentlemen, everybody today, both debates, you should be, our government in Washington could take a lesson from you guys. Thank you so much.
Last word. Listen, thank you, Mark, for joining us, our host on the right. Thank you, Hector, our host on the left. And thank you, Jeff. Until next time, this is Eye on You.
Nothing ever gonna make this world better if we don't start believing that love really, really, really is the answer. Everybody join hands, cause it's time now.